Oh. Can you hear me now?
I can hear you.
Oh, wonderful. Can you see me?
I did for a moment. I don't see you now. Let me go back.
I got you, Reg.
Oh yeah, I see you now.
Okay, thank you.
Can we try it again? Mr. Bishop? Mr. Schultz here, Mr. Dunn? Here.
I can barely hear you.
Mr. Chair, we can barely hear you.
Okay. Can you hear me, brother man?
A little bit.
Not much.
Can you hear me?
A little.
Edwards.
The volume is not up loud enough, evidently.
It's not that. I don't know why they can't hear. What about now, Ms. Rose?
That's better. Thank you.
I'll start with the roll call again, Mr. Taylor.
Yes.
Edwards, yes. Mr. Bishop.
I'm here.
Mr. Sharp, here. Mr. Dunn.
I'm here.
Mr. Jenkins, here. Mr. Silver.
I'm here.
Ms. Washington.
Here.
Ms. E. Bullock.
Here?
Ms. S. Bullock.
Here.
This time I will entertain a motion to adopt the agenda. Mr. Chair, I move that we adopt the agenda. Motion by Mr. Sharp. Second by Mr. Edwards. All in favor? Ms. Davis?
Yes.
Edwards? Yes. Yes. Mr. Bishop?
Yes.
Mr. Sharp? Yes. Mr. Dunn?
Yes.
Mr. Jenkins? Yes. Mr. Silver?
Yes.
Ms. Washington?
Yes.
Ms. E. Bullock?
Yes.
Ms. S. Bullock?
Yes.
This time we will have a reopening. Good evening. For the past couple of weeks, we've had some events that came up that we thought we might want to come back and address the reopening plan. We got all points we just want to go over some things with you tonight and we'll talk about. Governor Cooper addressed the state with the concerns of the reopening of schools. basically taking it as an important thing to do. Also, Senate Bill 37 that has come out, which would
Excuse me,
require.
Dr. Ellis, you are still very low. People can't hear.
Thank you.
My mic
Yeah.
on? Is that better?
No, I mean, try holding it and see if that works.
It's good.
Lake volume is very low here.
It's,
That's like
yeah,
super.
pull it up.
I don't know how to pull it up.
That's the USB.
Testing 1, 2, 3.
That's better.
That better?
Yes,
A lot better.
lot better.
All right, I'll speak into this microphone and lean in. Be easier. Got it. All right, so the two events that came up was the Governor Cooper addressed the state about the reopening of schools. The next one was the Senate Bill 37, which came out that would require all districts to provide in-person instruction as well as a online option. I think that was voted on today and is moving through the Senate. It also addresses EC 504 students under a Plan A. We did survey the staff members this week, last week. And Dr. Catalano, will you reference that, please? Very well.
Absolutely. Good evening. We sent a survey out, I believe it was Monday, actually, and had quite a large response from the survey. It went to all staff members. We did have our staff members in our maintenance and child nutrition and transportation departments who did not have access to emails provide responses through other forms. And so that information has been compiled into this presentation for you tonight. Essentially, there was one main question in the survey and then an open-ended question that just asked for their thoughts. The first question, based on information you have now, how comfortable do you think you would be going back to face-to-face instruction? And you see the responses here. It's pretty consistent with what the previous survey that we sent out was. There were 19% of the staff members who responded that were extremely comfortable. 28.5% of the staff members who responded were somewhat comfortable. 32.4% were hesitant and concerned, and 20% were extremely uncomfortable. Can't remember if I said this, but there were a total of 1,317 responses. So we had quite a good response rate on that. And this slide just shows you that information broken down by the employee group. So you can see teachers are on the right with the darker silver, extremely comfortable at the top of your chart, and then the lighter silver at the bottom of your chart of extremely uncomfortable. So you'll see that across the board, teachers, there were school and district administrators, other school staff, other district staff, and then instructional support staff. So those were the categories that they could select from, and you'll see that less than 25%, right around 20% of each of the groups was, it fell into that extremely uncomfortable category. So it's down below 25% for each of them. And then the next question on the survey was, what are your thoughts, questions, or suggestions to make sure our staff, students, and families feel safe, supported as we reopen schools? And this was an open-ended response, so they could type anything into it to just share their thoughts. And this is a summary of what those, of the trends that we saw across those survey comments. So 483 employees shared that having an opportunity to receive the vaccine would make them feel more comfortable. 320 employees shared that having adequate time to ensure that plans are in place to both maximize safety and protect the integrity of instruction would be beneficial. Some of the comments around that were, you know, if we do reopen, making things happens so that they've got time to plan for having students in the building. 220 employees shared that processes to ensure that masks were worn by all staff and students would make them feel more comfortable. 184 employees shared that having adequate time and resources to maintain a cleaning and sanitizing protocols would make them feel more comfortable. 146 employees shared that ensuring adequate social distancing is in place would make them feel more comfortable. And Mr. Thompson's going to speak to some of these already, or that we have in place already that he will talk to later in the presentation tonight.
I have a question.
Yes, ma'am.
And thank you. I think it was a very, very well done survey. I did have one question regarding the race. Several teachers wanted to know why was race one of the questions on the survey. And I noticed we didn't have a report on that as part of it tonight.
Right. No, ma'am. So we did include several demographic pieces in the survey, just in case anyone wanted it broken down any further. So we do have it. We did ask them what school they're from, race, gender. I think there may have been another. And it was really just so that we would be able to disaggregate it further if asked.
Thank you.
You're welcome.
So give us that information, please.
I can absolutely share the spreadsheet with you after the meeting tonight.
Why not now? If you have it, why not give us that information?
Yeah, so what I have is total responses for you, but I don't have their comfort level broken down in that manner. It took quite some time to get it broken down like I had it for you in the slides. But just as an idea of the 1,000 of those responses that we had, 50% of the responses were from white staff members. 22.4% of the responses were from Black or African American staff members, and 22.7% chose not to report their race. And the others were less than 2% for the other races. Did you want it by gender as well?
No.
Okay.
But I do have another question.
Yes, ma'am.
We had 1,317 responses. How many staff people do we have total?
Almost 2,000. I think it's slightly under 2,000. About 1,900 staff members.
Okay. Can we go back to the first slide?
Yes, ma'am.
Yeah, that one. When I look at that slide, if you combine hesitant and concerned with, which is, let's see, 32.4%. And then you have 20% extremely uncomfortable. That's over half of the respondents who have some problem or some concern about going back face to face in Plan B. That's over half of the people who responded to the survey. I just wanted to point that out. Thank you.
Any other questions?
Yes, you said we have about 1,900 total teachers. or staff?
It's staff members, total staff members. There are about, I think, 900 teachers.
900 teachers. Okay, so 2/3 of the teachers responded to the survey. No.
I didn't understand what Frank said.
I was asking about the number of teachers that responded to the survey. So if we have about 900 some teachers, 662 according to chart number 2. So we have about 2/3 of our teachers responded.
It's also,
If those 900 were teachers.
So 662 of the respondents responded saying that they were teachers. Yes,
662.
yes.
So we still have a third that did not respond.
Frank, please speak in the mic.
So that means we still have a third of our teachers that did not respond at all.
Right.
thank you so much for reaching out for our other staff members, our bus drivers, custodians, and other staff people in the building. I think that was a very good move because some of them were feeling a little left out. Make sure call and let us know.
And I would be remiss if I didn't thank Mr. Litke, Ms. Miller, and Mr. Davis for doing that at the last minute for us. So that was some work on their part, but definitely appreciated.
Yes, thank you all.
Good evening, everyone.
Good evening.
Governor Cooper on February 10th, yesterday, made the decision that North Carolina will move Group 3 frontline essential workers up to February 24th. And the reason he did so was because there's a limited supply, and the population of frontline essential workers it's a very large group. So based on the amount of the supply of vaccination versus the numbers in the frontline essential workers group, he made a decision to move the frontline essential workers up. And the ones that he moved up in the frontline essential workers group were those working in childcare or anyone in pre-K 12 schools starting on February 24th. Childcare setting is defined as childcare centers, pre-kindergarten programs, Head Start and early Head Start programs, preschool programs, and family childcare homes. K-12 school settings are traditional public schools, charter schools, and private non-public schools. North Carolina still plans to move to additional frontline essential workers on March 10th. I would like to take just a minute, and I believe I have Ms. Grant, Christy Grant on. And she can jump in when I finish here if she has anything to add. But Ms. Grant and Nurse Deb Terrell have been working with our health department to try to create a situation where we would be able to vaccinate our own staff using our school nurses. And at this point, we have 1,105 total staff members who have signed up to have vaccinations at our clinic when and if we are able to do so, which again, the health department is willing to work with us and to make this happen. In fact, Nurse Grant and Ms. Terrell had a meeting this week with some members from the health department to further verify that they are still on board with working with Nash County Public Schools to make this happen. Of the 1,105 individuals who are signed up for the group 1 that we have defined it to be 65 and older, there's 111. For group 2, which is 50 and older, there's 483 people who have signed up. For group 3, which is 49 and younger, we have 511 in that group. So before Governor Cooper sent his information out, the clinic opportunity for our staff 65 and older, they would be the first ones who we were trying to make sure got the vaccination. And I don't think that that would change because that is our older age population. So I still believe they would be at the front of the line. We are currently working with our schools and with our school nurse and getting information out to staff members so that they can complete a registration form to get back to our school nurses, who will then put this information in the registering database that the health department has, so we can ensure that our people are there. We have access to nurses from the health department if we're able to pull this clinic off. The purpose of the nurses being there from the health department, their role will be to help pull the vaccination from the vials, so that then our nurses can use the vaccination they pull from the vial to go ahead and vaccinate the individuals. We also hopefully will have access to emergency management to help in this process as well, and law enforcement. We are on board to use Nash Central High School. The reason why we want to use Nash Central High School is because Nash Central High School has been used. We know the traffic patterns. We know how to set things up there based on the health department using it on prior occasions to provide vaccinations to the members of Nash County. This is important information to understand concerning the vaccination, because sometimes we think that there's a lot of vaccinations out there and available right now, and they're just not. So I want to share some numbers. In Nash County, there's 94,298 residents. So far, first dose alone has been 8,667. Second doses administered has been 3,025. So between first and second doses administered in Nash County has only been 11,692. So there's a lot of people here, and there's still a lot more vaccinations to be done. So one of the things that Governor Cooper said yesterday was, even though that he has moved the timeline up to February 24th, it still may not be possible to start vaccinating educators who he has moved up in that group on that date. It all will be dependent upon the number of vaccines that is available to that area. Are there any questions for me?
I have a question. I just got a comment. I find it amazing to hear that vaccine, we don't have enough, but yet I'm hearing in Johnson County, they just have people, they called out and told people they had extra vaccines for vaccination. I don't understand why we ain't collaborating with that group to pull some of that in, when we're saying we don't have enough, but yet they got an oversupply.
I have a question, please.
Yes, ma'am.
Just a point of clarification. So vaccinations for educators may not start as as the governor projected on February 24th. I just want to be clear on that.
Yes, ma'am. If there's not enough vaccines that has been designated for the area, and there are still members in the 65 and older age group who has yet to be vaccinated, those individuals still will have first priority if they have signed up in the registry.
Okay, thank you.
Miss Grant, is there anything that you
I have
want
a
to
question
add?
before we move on, Mr. Farrell.
Yes, ma'am.
Just to clarify, so we're saying that those 65 and older are at the highest risk and they'll go first, but what about those who are not 65 but are still high risk? I didn't hear much about that. I just wanted to get some clarification.
So based on my understanding, and I'm gonna let Miss Grant jump in and help me answer that question. But based on my understanding, the group that we're in at this point in group 2 is for those who are 65 and older. So the governor made the decision to move up educators as frontline essential workers on February the 24th, putting them ahead of some of the other frontline essential workers because that group is such a large group. So, Ms. Grant,
Yes, sir.
is that correct?
Yes, sir. Yes, sir. And each county it'll depend on the availability of the vaccine for each county. So it's really dependent on the number that our county gets and then the context in which our county defines it. We've not heard differently. We are still planning on the 3 different groups at this time. We can regroup if we need to, certainly. But at this time, we've not been told differently that we wouldn't have the 3 age groups like we've planned for now.
So Ms. Grant, I got a question.
Sure.
I need to know the equitability of the distribution among counties. Do we know that information?
I do not, but I do not. We have asked that question, and I don't even know how they figure out the number of vaccine doses that go to each county. We do not, but I have asked that question.
So we have asked it, there's no response.
Not yet.
Mr. Sharp,
I think that's the point. Yes, sir.
I can tell you that your number of vaccines, what we're being told is it's based off population. And then when the county stops giving out the amount of vaccines, the number can go up or it can go down. So when you were speaking of one of our neighboring counties, if they get to the point that they stop administering vaccines, the amount that they get will lessen and that distribution will increase for other counties that are in need.
Thank you, sir. I appreciate that. I would think they would be distributed based on the population size, but someone should be able to give us that data. I find it hard to believe that we don't know that information and we can't get it.
Mr. Sharp, we have a call tomorrow, superintendents, with the Department of Health and Human Services, I believe, at 10 to go over the vaccination protocol that changed. So I might get some more answers. I know Ms. Grant knows about that call, but that'll be tomorrow, and they might give us a formula of some sort of how they're going to roll this out. So we might have something I can get to you.
Okay. Thank you.
And the other thing to bear in mind is that for the state of North Carolina, as a whole, the federal government has only given 2 million, a little over 2 million vaccinations to the state of North Carolina. A little over 300,000 of those doses are given to places like nursing homes. And a little over 1 million of them have been first dose vaccinations, and about 700,000 of those has been second dose.
May I say something, ask a question?
Yes, ma'am.
So am I understanding then that the hype about our teachers and our educators being in the group now to get vaccinated is not really on its face a true statement? Because it seems like they might be put in a group that would get vaccinated sooner, possibly, rather than later. But if we are not sent the medication, then we can't vaccinate all our educators. Is that correct?
That's correct, because we still will be contending with the individuals within the community
In
at
group
large.
1 and 1B.
Yes, ma'am.
So then our teachers who are being asked to go back face to face and eventually by law, we will have told them something that we know that we're not going to be able to do, because we have no control of the vaccination, but we do have control over what's being told to our staff. And I'd rather we just tell them up front, rather than have them get excited that, yeah, we're going to get vaccinated, and yeah, our probability of being infected goes down. To me, the two don't jive. Something is wrong with this picture. Am I the only one seeing that? We're telling our folks one thing when we know we may not be able to do it.
I
And
think
with that in mind,
Miss Evelyn, I got a question.
yes,
Can you please tell me what it is that our staff has been told?
we are talking about, Dean, we are talking about our staff going
Understand that,
back to school.
but I'm hearing that there's some type of imply there that the superintendent has sent out some message about or to the staff of what to expect with the vaccines. Is that what you're saying?
I'm not saying anything yet that the superintendent said. What
But you
I
just said that we're telling the staff that about vaccines, and that's what I'm trying to figure out is what is the message that you have heard that has come from the central office to the staff?
Did I say that the superintendent said it? Did I say that?
You said
I
we.
don't think so.
You said we. And so, and when you say we, the superintendent is up here with us. And so usually it's not the board that sends out a message about vaccinations or anybody else.
Let me just tell you right now. Let me just tell you what I'm talking about.
I just want to know what the message is that we have supposedly sent to the staff.
You asked the question, so let me tell you in no uncertain terms, very clearly and very succinctly, what I am saying. The governor, our governor, said that our teachers, our educators would be moved up in the process of being vaccinated. That's good news. We fail to be told, which is what I'm hearing now, that yeah, that's true, but if the state does not send us enough vaccinations, then we can't give them. Of course, I know that, but is that made public? Our people think that, yeah, we're going to start being vaccinated on the 24th, and we are ready to go back to school. We just want our vaccination. Let me read you something. Let's meet in the middle. And this is an email I got from one of our staff members. Please consider keeping our back to school date the same. That way, teachers will all be able to get our vaccines get our vaccines is in caps. If we choose before we come back, coming back any sooner would be much more stress on the system than need be. I am writing to speak for myself and my direct coworkers. I am afraid of the message it will send to staff if you send us back 2 weeks, a mere 4 days for a child, 4 school days for a child before we are able to get vaccines. I don't see where 4 to 8 days more for a child would be any trouble, considering we have been out this long. 1 death is all it would take. 4 to 8 school days are not worth taking the chance. In the middle high schools, we have grown people in class. We do not have little ones that can't transmit. I differ with that. Little ones can, but okay. Please consider leaving the back to school date the same. No one on either side could argue the validity of each other's argument at that point. Let's go back to our kiddos safely. What I am saying is that if our teachers, our staff cannot be vaccinated, all of them, we need to tell them up front what they have heard, not necessarily from the superintendent, I might add, is that teachers, all of them, will be vaccinated. There's a problem when you tell me that, and then I'm hearing tonight that we may not have enough, we won't have enough vaccination or may not have enough to give to our staff. There's an issue with that for me. And I hope I made that quite clear now, Mr. Edwards.
Did you get that, Dean?
Yeah, I'm clear.
Thank you.
So, in terms of the vaccination for our frontline essential workers, as Ms. Bullitt stated, that group educators have moved up to the front of that line. It's such a large group, the frontline essential workers, that the governor thought that it was important to put teachers at the front of that group and to have the date mandated as, if possible, on February 24th, that group should begin its vaccination. And then on March 10th, he would fold in the remainder in the remainder groups that's in group 3 of essential workers. And
So I'm sorry I'm interrupting, but that was the governor saying that he moved the teachers from one section and moved them up into another section just as a group, correct?
yes,
Thank you.
And inside that group, I'm hearing that he's moving them up inside that group.
yes, yes.
So there's a higher probability that that group will see vaccination a lot sooner than we anticipate. And I think that's what Mr. Farrell's saying, because while the population is great, there's a large number, we've moved it up, or he's moved up 2 steps, one group above to the next group, and then at the top of the group, on top of that group. So I think that's what I'm hearing you saying, Mr. Farrell.
That's correct.
Thank you.
Ms. Grant, is there anything that I missed?
No, sir, I think that's it. We were just excited to hear that at least teachers were eligible to start receiving the vaccination on that date. And we remain hopeful that we are going to get to vaccinate our staff as quickly as possible. And the health department is really working with us in emergency management. So we are on a good track to get our staff vaccinated as quickly as possible.
I have one quick question, and thank you, Ms. Grant. I am excited about that possibility as well. We are going to be very prayerful. But my concern, are we also including our bus drivers, our custodians, and our tech people in this number?
Absolutely. Yes, sir, we are. Yes, ma'am, we are. We have reached out to everybody, and we actually have their forms back already and are working on registration for them.
Thank you.
You're welcome.
And just to read who the governor has defined as K-12 personnel, teachers, teacher assistants, student teachers, special education teachers and therapists, school and district administrators, school transportation drivers, food service workers, school support staff that includes counselors, social workers, speech and language pathologists, custodial and maintenance staff, media and IT specialists, school safety personnel, librarians, school administrative staff, instructional support staff, and school nurses who's already included in group one.
Thank you.
Thank you, Mr. Farrow. Thank you, sir.
But I do want to reiterate, we don't have, that is one thing we can't control is the vaccination and when we're getting the medicine. But I do want to, just remember in October, September, I think it was September, October, we ran Plan B, K-5 pre-K, without the talks of a vaccination. When the governor came out the other day, he was stressing to everyone that the vaccinations are probably not going to be out like we thought, which we're all seeing now. But as long as we follow those 3 W's, and I'm telling you, and I'm going to put a shout out to the elementary folks and everyone that's been in these buildings, middle, high school, we have been following this protocol, which has allowed us to stay safe. And that's why it's worked for us. So I understand the vaccination is an issue. Me and Mr. Farrow speak of that a lot because we can't control that piece. But we can control the pieces when we're in that school building and we follow the guidelines we have set forth. That's why we have not had some of the issues in these bigger places of the malls and the grocery stores, because we are doing what we are supposed to do. So I just want to make clear. And I'm proud of that because that's a tough one. That's a heavy lift for everyone in these schools, and they're doing a very good job of it.
Dr. Ellis, if I may, Mr. Chair. I just want to reiterate what you said. I've been in the schools for last week, just going inside those schools, and it is phenomenal. And I guess what's amazing about it, just listen to the teachers, seeing the classrooms, and actually looking or listening to their lesson learned. So I tip my hats off to you, your staff, Mr. Nancy Smith, for coaching and working with your staff with that. They are phenomenal. I had a conversation with them, all of them at all levels. And some of the things that impressed me was the lesson learned that they're passing along to the other schools. Cafeteria, how they're serving foods, how they're not rotating kids all in the hallway. Sometimes we don't hear about that, but it's not happening. The teachers are rotating in and out, going to various classrooms. The students are maintaining. Correct me if I'm wrong, Ms. Smith. Yes, ma'am.
Can I ask another question?
So I just want to commend you guys for that.
I think Ms. Bullock got a question. Ms. Bullock, do you have a question?
I do. When the students go back to school, according to the guidelines, everybody should be wearing a mask. My question is, how are we going to enforce that when we don't even follow the rules? How are we going to tell a child, you have to do what the guideline says, but it looks like we are an exception to the guideline? How are we going to gel those two things?
Speaking from the elementary who came back K-5, we had a total of 2 students that would not or were not compliant and wearing masks. We have a committee that Mr. Farrow puts together with nurses, counselors, and the principal. We meet with that parent based on medical reasons or any sort of why they cannot wear a mask. Of those 2 decisions, they ended up wearing a mask. And if middle schools and high schools return to Plan B and a student is non-compliant, then that student easily can go to virtual, because we know the safety of masks, and it's going to be, we've stressed that to principals, in order for this to work, you have to be compliant with the 3 W's. So if a student does not want to wear it, then we will handle that student.
Yeah, because I've had, and this is on a personal note, but this is a point I want to make. I've had both doses of the vaccine, and my doctor told me today that so long as I wear my mask, I would be fine going out to meetings and traveling or whatever else I wanted to do. And I debated whether I was going to actually come to this meeting in person after my visit. But then I thought about it. I can have my mask on, but some of you don't wear a mask. And until we all get where we can follow the guidelines, I'm going to be virtual. But if we're talking about getting our kids back in school, we ought to be models showing our children what they need to be doing. And if we're not doing it, how are we going to make them do it? They will end up being virtual. Yet
I
again.
thank you so much for you bringing that up. Thank you.
But I do believe, Ms. Bullock, when we go to Plan B, we have had enough talks with principals. We have had elementary principals share their lessons learned, like Mr. Sharp said. If there is any non-compliance, then we're just going to address that student and we're going to go from there. But I don't see that being an issue when we go back to school. When we went and visited two school systems and we've had conversations with other school systems, that problem just hasn't come up, which probably says that that hasn't been an issue. But I mean, we're going to be ready if that's the case. And we'll move forward. But it just doesn't seem like that was an issue when we visited those other two school systems who've been in Plan A and B since probably September, October.
I think we should have enough confidence in our students. The ones that want to be back bad enough will wear a mask.
Agreed. The kids that went to school with my child at the elementary school, they had no issues with it.
Any more questions for Mr. Farrow, Ms. Grant?
I just want to say thank you guys for your hard work. You worked hard, labored. You know, we've had many discussions regarding this and how we get to where we need to be, because one of the most important thing is making sure we get our kids back in a place that we can start learning, teaching. And that's the echo that I'm hearing inside the schools. Granted, I'm a stickler when it goes to inside the schools trying to find something that's wrong so I can correct it, or at least make sure it get corrected before we expose our kids to that. And I can honestly say I went to 6 different schools in the last 2 days, and they all were in compliance. From the water fountains to the dispensing of water to how they hand sanitize. You know, I went into a school and I thought it was metal detectors, and I found out they weren't metal detectors, but they were temperature gauge. And that's amazing. You see everyone that goes to that door. And then the ones that for contact tracing, I had one lady who says she didn't know who I was. I just came up to the school and she said, "Sir, you can't come in until I get notification." And I'm saying, okay. So I sat down and I waited. And then the lady said, "That's Mr. Sharp." "Oh, Mr. Sharp, I'm sorry." You don't have to be sorry. You're doing your job. And that's exactly what she was doing. So I appreciate that.
I'd like to piggyback on that. My sons play sports, and I've been to Southern and Northern Nash and stuff, and temperatures are checked. They don't let the girls game start when the JV boys and everybody's out, so everybody's following because I'd like to piggyback on that. I know the athletic directors are doing a great job with that.
Sir.
So what I was going to present tonight in my team is that we would like to start on March 1st, Plan B, face-to-face and remote instruction for all students pre-kindergarten through grade 13, with the family option to still remain remote if those families want to remain remote. So it would look like this. We've changed this a couple of times. Mr. Thompson, if you could speak to the next slide when it comes to the schedule. I just wanted to update everyone what would Plan B look like in our model with remote and students coming back.
All right, so good evening. This slide is consistent with previous information that we've shown you with Plan B. It does show student tracking for virtual learning and for in-person learning. If you notice that track 1 students, for example, will report to in-person learning on week 1, and then you would have track 2 students that would remain virtual during that week, as well as your 100% virtual students. Then the following week, track 2 would report in person, and then your track 1 students will remain virtual along with your 100% virtual students. And I did want to remind you that with our traditional calendar that we had already tracked out the students who would show up on track 1 weeks and track 2 weeks. It was set for the March 22nd date, so we are going to look back a couple of weeks to try to adjust that, but that is already tracked out for us. And once again, I wanted to remind you that the 100% virtual students would, of course, be virtual each week, regardless if they're on track 1 or track 2. Yes, so we will definitely, with the reopening plan, look at wearing masks all the time. So our students, once again, will, just as was mentioned before, and staff will be wearing masks all times. With washing, cleaning, and sanitizing, we will, as you've seen, I think Mr. Sharp, you had seen that as well. There's sanitize in the schools. We are constantly working towards that. As far as the weight and maintaining social distancing, if you look in the classrooms, we already have desks spread out where they're 6 feet apart. So they are already social distanced. As we go into halls, there will be social distancing as well. As you know, high school will be a little different than elementary. Did want to mention that because high schools will have to transition because there's really no way around that with the number of courses, but we will do that safely. And we also next week are looking again at the schedule as far as the transition times to ensure that we meet enough transition time to ensure that it is safe, tremendously safe for all parties, whether it's our staff or our students.
Mr. Thompson.
Yes. Yes, sir.
If it is all right to ask a question, just real quickly, if we were to even look at Plan A at this point, do the logistics become very difficult in maintaining that distancing in some of the class? I mean, do we have the space to even look at Plan A for some of our school buildings?
Mr. Dunstan, I feel more comfortable answering that question as I've sent a survey out to the elementary principals, and I'll survey them to see if we have the space in most of our classrooms to socially distance. And in some of our classrooms we do, but in schools where we have a high percentage of our students returning for face-to-face instruction, it will become more problematic to socially distance. In talking to Mrs. Land, the principal at Red Oak, she would love to have her students back every day. But as you all know, the classrooms at Red Oak Elementary are so small that she can barely separate the students under Plan B. So if we move to Plan B logistically, we just have to look at spacing and if we can comfortably get all of the students in the classrooms.
That's on the Plan B.
That's Plan A.
Plan A.
Well, let me speak to Plan A because you can't do it. I've seen it. From what I've seen in the classrooms are too small, and you got too many students to try to. If you look, because I went and measured the size of the class. That's one of the reasons I went to classrooms. If you look at the size of the classroom, the 6-foot distance, and the required space required, this classrooms are too small. And then with the number of students, say, yeah, right now there may be you're at the verge right now with the minimum 13, 15. I think some of the biggest classrooms I've seen, you should be able to get about 16 students in a classroom. So when you start projecting over 16 students, you might have an issue. So I know you guys already started addressing some of those things as far as classroom spacing, but there's no way in the world you're going to talk about Plan A in a situation what you got with the facility right now.
And I'm assuming transportation creates the same issues at Plan A.
Right. So plan A, the concern we have is first the proximity in the rooms. You also got to think about how many kids are going to stay virtual. So if half your students want to stay virtual, you could possibly do plan A. But if 75% of your kids want to come back to school, you're going to present a problem. K3 has class size numbers that have to be adhered to. 4th and 5th grade don't. We have classes right now in 4th and 5th grade of probably 30. So that's going to be the issue.
That's right.
In plan A if you try to do K5. Now, we've talked about, Mr. Davis has gone to some of these schools and started measuring. There are some schools that could, but a lot of it really depends on, are you willing to lose the 3 foot, 6 foot distance, 6 foot distancing in the classroom? And I think that's going to be a concern for us, I know.
How about in our EC?
Yeah, and in transportation, the concern, right now it's 1 child per seat. When you start the plan A, they're going to tell you it is recommended but not required to have 1 in a seat. So if you start putting 2 kids on a seat, 2 or 3, you're losing that. In my opinion, you're not following those 3 W's, and that's where you got to start thinking of. So what are you going to do? And it becomes, are you going to ride the bus or you're not going to ride the bus? So that's why I think Ms. Nancy Smith's group, we started asking first principals, what do you think? Then you start talking to Mr. Davis, you start going to the classrooms, then you start asking transportation, who's going to ride a bus? And then you go school by school to see what you can do. So
I'm sorry, Don.
Yeah. Well, and in my opinion, if you do go to A, you might have some that want to dump out of A and go back to virtual because some parents might feel, but now my kid you got a kid sitting right beside me. So it just causes a little more.
I don't think that's a problem.
Any other questions?
How about in our EC classes?
Ms. Grant, are you on to speak to EC? Because I know that was one of the Senate bill conversations about Plan A.
Yes, sir. It's the same thing as Ms. Nancy Smith spoke about. Some of our classrooms do allow for the 6 feet social distancing and some do not. So it would be an inequitable access across the district with the class size.
Thank you.
You're welcome.
Any other questions? What I'd like to do at this time is go down each board member.
Franklin, excuse me, Mr. Chair. I think Donovan had his question.
Well, it sounds like Franklin was on the right track because I was just wondering if we have a list of things. So go ahead, Franklin.
What I'd like to do is go down each district, and each board member has a concern or voice their opinion on this reopening plan. We'll start with Ms. Chavis.
Thank you. And I think all of us realize that as hard and as concerned as we are about our staff and our students, it's a freight train coming. So if it's coming, we can't stop it, but we might need to get back the track safely. I have a lot of lists from various people, from bus drivers, custodians, and our administrators as well, and teachers. One was the ventilation. Are we going to be able to properly ventilate classrooms and buses? Because buses are a closed, heated area. And will there be monitors to assure that students keep those masks up? And for the buses that don't have a monitor, how are we going to do that? In regards to nurses, I know we have a lot of nurses that share schools. In this crisis, I would hope we could figure out a way to at least have a nurse on each campus, because if something should happen and a child should throw up, that's not something you could take for granted as to how to clean it up as it used to be. So do we have body fluid spill kits available? Who will make decisions if a nurse is not on the campus? Who will stay with a child if they have COVID symptoms? If a child is sick in a classroom with other students, will parents be notified that their child has been in the presence of a situation, or will we be evacuating a kid or a classroom if a child got sick? It's a lot in here. One, water. I know right now a lot of water fountains are not available for use for safety reasons. I would certainly hope we will be able to figure out a way, and I think I mentioned with Dr. Ellis earlier, to bring bottled water or have it available for students, because for them to bring their own, they're going to fill it up in a bathroom, and that's opening a whole different can of infectious problems. And these are a lot, and I know I feel very good and sure that we will be following the mask protocol, because that was one of the concerns I got over and over again from all sides. How are we going to make sure they stay in those masks? And I think we can do that. We've answered some of the questions regarding the vaccine, and thank you for doing all that hard work. I did hear you mention that there would be hand sanitizers. The concern that a lot of teachers have had, if we don't have enough Kleenex in a room in a year, are we going to have enough hand sanitizer available along with the bottled water? And let me see, I think I just about hit everything. Oh, one other thing, and this was more or less just something to think about that one teacher shared with me. A lot of parents have taken the social media as a way to bash them, and they don't appreciate it. If they're going to take care of your kid coming back to school, it's not such a good idea to slander somebody or to bash people. Let's realize we didn't cause this bad virus. We're all having to figure out ways to deal with it, and it's very frustrating for everybody. But I think as a unified group of board members, parents, and educators, we're going to do the best we can for our students. And I think if we all keep in mind the kids' safety and our staff safety is crucial, and that's what we need to work toward. Not personal feelings, but group feelings.
Thank you. Mr. Edwards?
I'd just like to say that I've had a whole lot of phone calls, emails, just like everybody else has. But when you get the handwritten letters from the children saying, thank you, please get us back to schools, that means a lot. And I appreciate everybody who has sent those letters. And I also appreciate the people who have taken time to written all the emails, just like everybody else has been receiving. On the concern end, one thing that has been brought up for the past few months is this Virex spray. Several people have, or teachers have asked, can they get clarification on the time it takes for classes to change, and they only get supposedly 5 minutes on a class change, and the Virex supposedly takes 10 minutes. I just told the teacher, I was like, we'll spray it 5 minutes before the people leave, but wait for Mr. Davis to give you more clarification about that. So can you speak to that real quick?
And I know what Mr. Thompson spoke of with the teacher advisory council today. They spoke of class changes, things of that nature, because it's going to be new for middle and high school. And that's going to be looked into. Mr. Davis, can you comment on the Virex concern?
Yes. The Virex is a 10-minute standalone. We've addressed that from day one. When we're spraying it at the end of the day with these classroom teachers, that's the time during the school day that we can let it sit 10 minutes for the next day to get its full effect. That's what they're saying. The label tells you it needs to sit a full 10 minutes to be 100%. But we're with the guidelines of changing classes and custodians moving about the building during the day, spraying it and wiping it gives you some protection, but it does not give you the 100%. But we're under the direction that something is better than nothing. But the 10 minutes will be at the end of the school day, which is the reason we gave this to the teachers to do in their classrooms.
This just may seem like a very, very elementary substitute for that, but while I was talking with the teacher, I just suggested, hey, and I know how it was when we were all in high school. Those last 5 minutes before the bell rings really ain't much going on anyway. Go ahead and spray it then. You get your 10 minutes, and that way they feel better too. What's your thoughts?
I have talked with a couple of principals about this. I do not, really want the Virex sprayed while a student is at the desk. In the last 5 minutes, if they do put them up against the wall, they spray it, they wait the 5 or the full 10 before they bring the next ones in. That is not an issue. What we don't want is spraying the Virex with kids sitting in a desk. That's the main issue there.
Correct. And I there's no issue there with me about that. You wouldn't want to sit there and smell chemicals for 5 minutes and have a child walking down the hall that's high or sick. But I just figured those last 5 minutes of class just to help them out. That gives the teachers their time for them to feel more comfortable, makes or helps the chemical do its job, and we have that one more level of security. Thank you.
Can I comment on that? It came up to me as well. And one of the things that I tell people, working in pharmaceuticals, working in clean room, and that certain amount of time is what we call dwell time. And that dwell times allows that chemical to take its full component parts. And when you don't use that dwell time, it's just like you may as well be using some type of disinfectant. And the other thing is, and Shannon, I think you can answer this question, which I'm hoping that you do. That stuff is pretty much when you get it, it's in this concentrated form. You do the diluting at your shop and then distribute it out to the schools, or do the schools do the mixing themselves?
There are mixing containers at each site, so it's self-mixes, it's calibrated. Custodians do feel this. But keep in mind too, with the Virex, again, that is one of 6 tools we use in this school. So there is no one magic bullet. It's kind of what Dr. Ellis mentioned earlier. We're doing temperature checks, mask, hand sanitizing, social distance, Virex, and washing hands. So there is no one magic bullet. It's all of these things we're doing together that will prevent the spread, not just one thing we're doing.
So Mr. Davis,
I'm sorry.
So Mr. Davis, what is the effect upon teachers' clothing? Do we know anything about how they would affect the clothing of the instructors?
I have seen and have not read anything on the level about it. It's not Clorox. There are people using a Clorox solution. This is not a Clorox solution. So we haven't had any issues, and it is diluted with water. So we're not spraying a full dose of this chemical. And it's a chemical that we used prior to the pandemic. This is something we've been using in the buildings for several years. So this is not something we've just started using.
So Shannon, we had MSDS at the office. Where are the MSDS for those?
There should be MSDS at every school and every location where this is. And that's not only for this chemical. Any chemical we have in the district, MSDS are in the office.
That's right. Okay, Mr. Visit.
I was just kind of say I support the plan. I wish we could go back on the 22nd, but I understand why we can't. So March 1st, I'll take that. The only request I have is to Dr. Ellis and Mr. Thompson. I think a large part of our hesitation is coming from our high school staff. I think we just haven't done a good job of relaying the plan to them. I think you have a plan. I think it's a good plan. We just need to make sure that plan is getting out. Majority of the emails and the staff that I've talked to said, you know, we got that survey that you're asking for recommendations. We can't recommend if we don't know what the plan is. So make sure it is getting pushed all the way down to the lowest level of our staff. I think if you push the plan out a little better than what we've done in our high schools, you may have seen those numbers a whole lot higher than in 50-50. So I'm just not going to keep beating a dead horse here. I support the plan. Get the plan out to our staff, educate them. Let's get these kids back in school.
Thank you, sir. Mr. Sharp.
Yes.
Mr. Dunn.
Yeah, thank you, Franklin. Just really quickly, I want to thank all the board members and a lot of our staff that have answered my phone calls and just taken the time to engage and discuss. I feel like that, for me, has been beneficial, and it has really brought me into the light of everybody's thinking and concerns and the feedback that they're getting. I just want to thank Franklin and Bill. I feel like our leadership in this time has done a good job in trying to get some consensus and pull us together. And to me, that means a lot. They've both been very transparent with me these last, 30, 45 days or so that we're working on. And The other thing I wanted to mention, you know, I want us to move forward. I want us to support this change that the superintendent is bringing to us, and I want to do it ahead of the mandate that may be coming from the state. You know, even if it does align kind of ultimately, I think, with where I would like to go. I don't want us as a local governing body to be told from the state level what we need to be doing, and I'm assuming the rest of us probably feel that same way. I want us to have the authority to move forward with our decisions and hopefully do it well. So thank you all again for engaging. Thank you all for caring as much as you do. And Mr. Chairman, I appreciate the time.
Thank you. Mr. Jenkins?
Well, I wanted to open the 25th, and nothing changed in my mind in reference to that. However, like Chris said, you know, I understand why we can't do it the 22nd, because but of certain busing issues. But elementary worked good last time. Teachers were happy with it. The ones I've spoken with, they said the kids learned a whole lot better in person. I have all the confidence in the world that if we do run into a snag, that Dr. Ellis will take care of it. He'll address it. And finally, I want these seniors. They've really suffered. Last year, seniors suffered a lot. This year, seniors haven't even been to school yet. I want to challenge Dr. Ellis and his team to make sure they have a graduation this year, unless things go south. With that being said, I'm gonna say the 3 words I always say: open the schools.
Mr. Silver?
Thank you, Chairman Lang. I have not deviated a lot from what I've been thinking all along. I'm certainly concerned with the students all returning to school. However, I am also concerned about the safety of our teachers, the students, and the administrators and all of the Nash County family. However, I do support returning to school, but I'm just afraid that we will not be ready by the first week of March. I'm in favor of maybe the elementary kids going back, but as far as the whole entire school returning back, I'm a little unsure about that. I don't think that we're quite ready there yet for that. I'm hopeful that perhaps by the first week in March, we will be ready, but that's a quick turnaround. But I think it's important to give families an opportunity to return to school for those who want to, and give the families a chance to do virtually if they choose to do it that route. But let's just pray and hope that everybody can stay safe, because we really want the Nash County Public Schools family to all be safe from that regard.
Ms. Washington?
Yes, I think as board members, we are tasked with making decisions for all the stakeholders in this school district. That being said, I still have reservations. I need to know if a staff assessment has been done to ensure that we will have enough teachers willing to return to accommodate any students who want to return at this point. Also, I do think the vaccinations of the teachers will help us greatly. I believe that kids need to be in school, but I cannot support a decision that will have them returning, any stakeholder returning under unsafe conditions. So I need to know that everyone will be safe, or at least the teachers being vaccinated would mitigate some of the transmission from student to teacher or vice versa. Also, I'm concerned about, I heard someone mention that buses will run at smaller capacities. It's going to take longer for students to get to school. How is that being addressed? Also, the transition time in high school, I heard the time being addressed, but I'm concerned about the space. How can students in high school safely transition from class to class and also social distance, 6 feet apart? So I would ask the board, just to consider all of those factors. We are tasked with making decisions for all stakeholders in this district.
Thank you. Ms. E. Bullock? Ms. E. Bullock.
I'm sorry, I'm just talking and my screen was just muted, was still muted. But what I'm saying is that I want our kids back in school. I want them back in school though safely. I would want us to wait until our teachers have been vaccinated, or at least as many as possible. Now, someone mentioned about going back to school before the law says that we have to, but with the statute, Senate Bill 37, after that bill is enacted, which it has not been yet, after that bill has been enacted, then we've got 15 days after that date to have our kids back in school. That gives us time to iron out this problem of whether we will be able to vaccinate our staff. Because going back to school, having the kids in school and not having teachers to teach them is not doing us much good. So I'm not in favor of going back on the 1st. I would like us to wait and go back before the 15-day time after the enactment. That gives us time to work on vaccinating our staff, which to me is most important.
Okay, Ms. S. Bullock.
Yes, I just want to say thank you to the teachers, the parents, the community who have reached out through whatever type of communication. I appreciate it. All of those parts have been heard, and I think we need to take everyone's opinion and their needs into consideration. I think it is important that we move forward. I think it's important that we have a plan. We have said for years that we need to listen to our teachers. Our teachers are speaking. When we do go back, whenever that is, we need to listen to their needs, and we need to have those resources there, and it needs to be consistent. That's one of my concerns, where we have a plan and we say, this is what we're going to do, but we need to make sure that is materialized from now until the end of the school year. So I'm with moving forward, but I'm also definitely wanting to listen to the teachers, listen to the needs of the students, and work together and not pit our board against the community, not pit our teachers against the parents. None of this is going to work. It's chaotic and it's ridiculous, and we need to come together.
Thank you. I just got a few comments. You know, we were all elected in our districts to do what was best for our students and our teachers. Now, even something like Senate Bill 37 has been politicized, where we have different representatives in our own district. Some are for and some are against. That did not even cross my mind, because we were operating with students in a building long before Senate Bill 37 was even thought of. So as far as a Senate bill telling us when we need to go back to school, that has not even crossed my mind. In fact, I made a statement to a couple of people. Sometimes the closer you get to Raleigh, the more common sense eludes you. But I think we need to do what is best for our students and our school system and our teachers. At this time, yes, Mr. Sharp.
Mr. Chair, just before you take your vote, I too just want to acknowledge, I just want to wait to hear the consensus of the board, but I want to acknowledge the teachers, the support staff, and just the folks that I've encountered in the last few weeks, just going face to face and talking to teachers and staff as far as the readability of their schools for receiving students. And the situation, the heightening is really high. They're excited about it. They miss their kids. Can't wait to get them back in. but at the same time, there is some fear and apprehension. I have it every day. You know, I go to work every day, and the same situation that applies to me on my job applies to the teachers on theirs as well. So we have a responsibility to mandate what we're called to do. We went into our profession because we love what we do. Every job has risk. Some of them a little bit higher than others. But I think what our parents have learned to appreciate the teachers who suffer or work with their children every day. It's one thing to talk about it, but it's another thing when you live it out and you got to see what your teachers are doing with your kids. So I think we need to be recognizing our teachers and our support staff. And Ms. Nancy Smith, please convey that to your staff, that those teachers are doing a phenomenal job. I know the fear factor is there. I know everything else that they're going through. And I just want to say thank you from the depths of my heart. And for all those letters, I got letters, or we all got letters. It's almost like somebody writing a dissertation. And I'm thinking, wow, this is a whole lot of writing. So, that's a whole lot of time. People are showing their concern. And so I applaud that as well for the activity, just getting engaged. So with that said, Dr. Ellis, thank you for all that you and your staff does. You guys are doing phenomenal. And so I just want to say thank you as well. Mr. Farrell, I know your group is working with the inside and out, and working with the health department may not be easy all the time getting the answer that you need, but you're persevering, you're staying with it. So board members, I think we need to be cognizant of each other. I think sometimes we speak out and just realizing you're here to be an example. We are here to be an example. And sometimes we say stuff at the heat of the minute. We need to watch what we say and how we say it, because what we say and how we say it reflects upon who not only who you are, but who you represent. And I don't know about anybody else, but I represent someone who's higher than me. And it's not my mom and dad. I'm thinking about my father, my heavenly father. So I want to be an example to him, and no matter what I say, it doesn't matter what John says or Susan says. It's not about them. It's all about, as Miss Ann would say, our children. That's the first priority. So when we look at our first priority, we can overlook the faults we might see in each other and look to them. So I just want to say, I appreciate my constituent for allowing me to serve in this capacity. And as long as I have breath in my lungs, I'm going to support my superintendent and his staff and our kids and our students, for it's all about developing and growing our children. Thank you, Mr. Chair.
Keeping the main thing, the main
thing. That's Ms. Edge.
Any more comments? At this time, I would be willing to entertain a motion.
Mr. Chair, I would move that we move upon the superintendent's recommendation to start up school the 1st of March.
Second.
Under Plan B.
Have a motion by Mr. Sharp, second by Mr. Jenkins. Roll call vote. Ms. Chavis,
Yes.
Mr. Edwards,
Yes.
I'm a yes. Mr. Bizzett,
Yes.
Mr. Sharp,
Yes.
Mr. Dunton,
Yes.
Mr. Jenkins,
Definitely a yes.
Mr. Silver,
Yes.
Ms. Washington,
No.
Ms. E. Bullock,
You muted.
No,
Ms. E. Bullock.
no,
Excuse me? Okay,
no,
all right, Ms. S. Bullock.
Yes.
By a 9-2 vote, the motion is passed. Any other questions at this time?
I have one.
Okay,
And this is probably directed to Dr. Ellis. I looked at your plan. I think it's workable, but we don't know what the future holds with the new strand that they are projecting to hit us next. Do you plan, if this gets too hot to hold, because some people don't believe a stove will burn until they touch it. So as a board member, I'm stepping back and let a few people touch some stuff. But if it causes some detrimental situations for our teachers or our students, do you have a recourse plan?
So just remember, you're going to be receiving all the metric data every Friday like we've been giving you. We talked about if there were individual schools that were high COVID rates, contact tracing. We are still in the process. If there's a school that we need to close, if there's a classroom, if there's a hallway, we are still using that rule, just like we did when we were speaking of January. So that's why we're still monitoring that. It's going to be in place. If a school becomes hot and we need to do something, that same conversation is going to take place.
Okay, thank you.
Any other questions? If not, I will entertain a motion to adjourn.
So moved.
Motion by
Second.
Mr. Sharp, second by Ms. Chavis. All in favor, say aye.
Aye.
All opposed,